Live from Studio 2A in PIX Plaza, this is the PIX 11 Morning News with Sukanya Krishnan and Corey Chambers.
7:35. Have you ever had those bizarre nightmares that seem like, they just won't go away? You're paralyzed, you can't move, you can't speak.
Yeah, there's actually a name for this, okay? It's called sleep paralysis. Kristen Cole's here to shed some light on who gets it and how to make it stop.
Yeah, and the crazy thing is so many of us do get this. It's so bizarre, and many people think that they're the only ones who have these weird dreams, and then they just kind of brush it off. I had them years ago. Caitlin Monty has them. She was tweeting out this morning, and that's because 4 out of 10 of us get them, usually when we're extremely sleep deprived, which many Americans struggle with. They're terrifying, anxiety-provoking, and generally completely preventable.
My entire body was just immobile. I had no control over my limbs, any movement. I was just frozen stuck, heart pounding, like I could feel like my heart was pounding out of my chest, shortness of breath.
But Dr. Jordan Stern, an expert in helping us to sleep better, says this is a phenomenon born out of our nationwide growing lack of sleep.
The entire population in the United States is sleep deprived. We do not sleep enough.
He says there's actually a straightforward fix.
At some point, we may actually become conscious in the middle of the dream, essentially. Very frightening. But it's common, and it goes away when you improve your sleep hygiene.
Stern has many ways to fix the problems that are ailing us in bed and says if we ignore our lack of sleep, the problems only get bigger.
If we don't sleep enough, lots of things go wrong. We get depressed. We become anxious. We develop high blood pressure. We develop heart disease. We develop diabetes. We have difficulty controlling our weight.
Snoring and sleep apnea are the 2 warning flags that we're not sleeping right.
How are you?
To fix, Dr. Stern uses a small in-office procedure that heats up and shrinks the tissue on the back of the tongue. A few treatments usually solve the problem. Custom mouth guards can also keep the jaw properly positioned to prevent snoring. And for those of us who've suffered the terrifying episodes of sleep paralysis, they'd do anything not to face it again.
I can remember it like it was last night.
So, for the issue, for many people, even if they're logging 8 hours in bed, it's not really good sleep because of snoring or sleep apnea, which absolutely needs to be addressed by a doctor. Sleep studies can be done at home. They're covered by insurance, and easy fixes can cure the problem